ready with me as I speak about how to conduct self-examinations for the early detection of breast cancer. Happy Breast Cancer Awareness Month. Today I'm going to be speaking very briefly about how to conduct self-examinations, what to look for, tips on how to do it, and if you find anything suspicious, what are your next steps. And as always, please let me know if you have any questions in the comments, anything about this video, or anything related to breast cancer in general. So let's get on with it. In 2023, breast cancer was one of the most common cancers globally, and it can occur in any individual regardless of gender, so checking regularly is a potentially life-saving practice. To do the exam, you will first do it standing in front of the mirror with one hand at your side, the other hand feeling the entire breast as well as your underarms. Then put one arm behind your head and feel with the alternate hand, and do that on both sides. Then you'll do it lying down with one arm behind your head and using the other hand to reach over to the opposite breast and to feel it again. This is to feel the breast tissue from all angles. It is very quick and very simple to do. Illustrations attached again at the end. This process needs to be repeated at least once a month so that you can adequately check for changes. When to start self-exams? It is most commonly suggested to start at the age of 20 years old, but I feel like starting the earlier the better, because starting with a routine with your child, especially if you have a family history, can be very helpful in the later years. This also helps you and your child to establish what your breasts will look like on a normal basis. Okay, what are you looking for? You're looking for changes in the breast shape, dimples that remain when pressing the breast tissue, skin texture or appearance changes, unusual discharge from the nipple, such as blood or clear discharge from one nipple, and a release of this discharge even when there is no squeezing, texture or appearance change in the nipple, such as discomfort or color change, pain in and around the breast area, even under the armpit, or dimples in the skin. While these are all things to look out for, don't panic if you see or feel any of these things, as it doesn't automatically mean cancer. There are a variety of reasons why any of these symptoms might be occurring. For example, a lump in the breast doesn't necessarily mean cancer. Some lumps are benign, meaning non-cancerous, and often lumps that are soft, squishy, and movable are commonly considered normal, while hard and immovable lumps might indicate a tumor. However, if you feel an unusual lump in your breast or any of the above symptoms, you should see a GP, as they will check and then refer you to the relevant specialist. I have seen some GPs say that you should check regularly if the lump remains after you first find it, especially after it remains after a full menstrual cycle. But when you decide to take action is up to your discretion, as well as the specific instructions from your GP as well. Now for some very important things that not everyone knows. Remember that the texture of every individual's breast is different, and when you're younger, your breast tissue is still developing, so it might be slightly lumpier even after puberty. Also, when you're sick or you have some infection of some sort, the lymph nodes under your armpits might also swell. So while lymph node swelling might be an indication of cancer, it could actually mean something else entirely. Also, during your menstrual cycle, your tissues feel very different to how they normally do because of the hormones that are being released. So you can actually wait to do your self-examinations for around 10 days after your period starts, or a week after it ends. Now, the GP will do a similar procedure to self-examinations when you go to them, so you should consider this when you are planning your trip to the GP. What will the GP do if they feel or see something suspicious? There are a couple of things that they might do. Some of these might include, they might send you for an ultrasound, especially if you're young, a mammogram, a biopsy, urine or blood tests, CT, X-ray, or MRI. Yes, there is a lot. Some of them are invasive, but don't stress about it because there are a lot of options, and it will all depend on the type of mass you find or be related to whatever concern that you are having. So you won't immediately have to go for the most invasive procedure. That will depend on the outcomes of your preliminary tests. Who is most susceptible? This depends on a variety of factors. Some of these might include high breast density, making it difficult to detect, genetic mutations, age, if you had started your menstruation earlier, if you had pregnancy later on in your life, but mainly if you had a family history. It is very important to start checking early if you had a strong family history. Thank you for watching. I hope this was helpful, and follow for more breast cancer related content. As promised, here are the illustrations on how to do these self-exams. Please pause to read, as these are very important in understanding how to conduct these tests.